Advanced practice registered nurses provide high-quality care to inpatient settings, ambulatory care settings, and also among the community. Advanced practice nurses are educated to delivering patient-centered care as members of the interdisciplinary team. Advanced practice registered nurses possess the ability to write orders for patients whenever they are being discharged home from hospitalizations, and many advanced practice registered nurses also are capable of prescribing various medical supplies or equipment that are needed for patients whenever they are being discharged home. When a patient arrives home after being discharged from the hospital, a nurse practitioner has either spoken with the family concerning best care practices for their loved one or has educated that patient as well as their family concerning the patient's condition, welfare, and care going forward while at home. Once the patient has been discharged and has been at home for multiple days, the patient or either the family members begin to put into effect all the information that they have learned while being hospitalized, and they may find that at some point they are having some challenges implementing the recommended plan of care. Now the dreadful day has arrived for the patient to pack up in their vehicle and for their family members to transport them to go and see their primary care physician for a follow-up appointment after they've been discharged from the hospital. While the patient sits in the waiting room waiting for their name to be called back to see their primary care provider, the patient and their family member realizes that they have been having difficulty providing the recommended care and have decided to inquire about the possibility of receiving home health services. We know that the patient was previously cared for while in the hospital by an advanced practice registered nurse. So now the patient is being cared for by a nurse practitioner during their follow-up examination. The nurse practitioner assesses the patient and creates a plan of care based on the patient's diagnosis and the patient's family's concerns. As the nurse practitioner sits down to document on the patient and recalls everything that was assessed during the examination, the practitioner determines that the findings show that this patient is indeed in dire need of home health services. So once again, the nurse practitioner has provided care for the patient while hospitalized, has written discharge orders for the patient to go home, has now seen the patient for a follow-up appointment, but can you believe that Medicare rules and regulations do not allow nurse practitioners to sign certification documents to allow for home health services? AANP has called on Congress to pass the Home Health Care Planning Improvement Act to authorize nurse practitioners to certify their own patients for home health services. Passing this bill will allow Medicare payment for home health services not only ordered by nurse practitioners, but also clinical nurse specialists, certified nurse midwives, and physician assistants. Assessment, ordering, performing, supervising, and interpreting diagnostic tests, making diagnoses, initiating and managing treatment of prescribed medications and non-pharmacological treatments, coordinating care, counseling, and educating patient families and communities are all duties performed by nurse practitioners, even face-to-face assessments for home health. Medicare allows coverage for home health care with no copay or deductible, but unfortunately, Medicare does not allow for nurse practitioners to independently order home health services for Medicare patients. A physician must certify that a patient is homebound and requires home care or physical therapy. The nurse practitioner has put forth an abundance of effort at this point while caring for this patient. But the regulations that Medicare have brought forth simply ties the nurse practitioner's hands by preventing the ability for the advanced practice registered nurse to operate to the full extent of their education and training. With that being said, a change is urgently needed for this process so that nurse practitioners can maximize their roles as a part of the healthcare team and also help fill in the gaps that are present in primary care. Change is not always welcomed, but when change can be beneficial, it is definitely needed. Allowing advanced practice nurses to authorize home health services allows provision of services in areas where physicians are limited, such as underserved urban and remote rural areas. This would indeed reduce delays in care for vulnerable, homebound patient populations who live in these areas. Patients living in these underserved areas could benefit so much from home health services. The advantages of home health include having care provided in a familiar surrounding, which could help with progressive conditions such as dementia. Care is personalized and tailored to everyday living to help to continue life normalcy with additional support when needed. Family participation is also a major advantage of home health services. Family participation provides the opportunity for loved ones to be present and to be a positive impact in the patient's care, all while maintaining patient independence. Home health services are usually a lot less expensive and are more cost effective compared to institutional settings. Advanced practice registered nurses also play a significant role in preventing Medicare fraud through face-to-face assessments. It is imperative for nurse practitioners to be able to independently prescribe home health services. Releasing this practice restriction can aid in substantial improvement of health in the homebound patient population, which results in progressive improvement in patient outcomes as well as enhancing quality of life for this population. The end goal of home health is to improve function, live with greater independence, and to become as self-sufficient as possible. Advanced practice registered nurses have the capability to initiate this process, and barriers to practice should be removed so that patients can benefit from home health services in a more timely fashion.